Hello everyone, I'm Dr. Monica. Today's video will be on case control study. So let's begin with the topic. So according to John M. Last, case control study is the observational epidemiologic study of persons with the disease of interest and a suitable control group of persons without the disease, which means that this type of study, it looks at two groups of people where one group has a disease and the other group does not have a disease. Then the researcher is going to compare them to find out what might have caused the disease. Research studies are mainly divided into two types, that is descriptive and analytical. Analytical studies, they are further divided into two types, that is observational and experimental. A case control study is a type of analytical observational study where the researchers compare people with a disease to people without it to find the possible causes. So a case control study is retrospective study. Retrospective means looking back in time. In this, the researchers start with people who already have the disease and they look back in time to see what they were exposed to. It is mainly used to find the possible cause of the disease. So let's first understand what case and control represent in case control study. Case represent the individuals who have the outcome of interest, whereas controls are the individuals who do not have the outcome of interest. So let's first see the example. Researchers want to investigate the risk factors for periodontitis. Here, the case includes the individuals who have been diagnosed with periodontitis, whereas controls include the individuals similar to the cases but who do not have periodontitis. Now, how to know if the study design is case control study or not? Firstly, the exposure and outcome already happened before the study begins. In simple terms, exposure here is risk factor and outcome here is the disease. Second is the study looks backwards. That is, it starts from the disease to find the cause. Thirdly, there is the control group to compare with the group that has the disease or the case. So let's understand the design of a case control study with this example. Here, the case consists of periodontitis patient, whereas the control is a non-periodontitis patient. Both case and control, they are exposed with cigarette smoking, and odds ratio is used to test the association between cigarette smoking and periodontitis. So let's understand the elements of a case control study. So firstly, we have is the selection of cases, which includes the population having the disease. Then is the selection of controls, in which population is selected without the disease. Next comes the information on exposure, and then we analyze the case and control with exposure and unexposed cases. So starting with the selection of cases, cases should include all the people from the population who have the disease of interest. Selection should be independent of the exposure, which means we don't choose people based on whether they are exposed or not. There must be clear definition of the outcome of the disease being studied so that only true cases are included. So cases can be selected from population, hospital or a clinic setup. So next is selection of controls. Firstly, we have is population-based controls. These are chosen from the same general population as the cases. Next is hospital-based controls. These are selected from the same hospitals where the cases were found. Lastly, we have friends or neighborhood. In this, the controls are chosen from the same social or geographic environment from where cases were selected without considering their exposure status. So next is information on exposure. So to get reliable results in case control study, it's important to collect good information about exposure. This means that the data should be objective, that is, it should be measured in a way that it can be repeated by others and give the same result. Second is it should be accurate, which means that it should truly reflect the exposure and its possible effect on health. Lastly, it must be precise, to ensure good quality and to reduce errors. So matching is done to make sure that the cases and controls are similar in some important ways to make the study fair. In this, we have group matching, in which we match the whole group of controls to the group of cases, and then we have is the pair matching, in which we match each case with a control who is similar. So coming to the analysis part, odds ratio is a number we use in case control study to measure how strongly an exposure, that is smoking, is linked to a disease, that is periodontitis. In case control study, a 2 by 2 table is used to organize and compare the data. It shows how many people with the disease, that is the cases, and without the disease, that is the control, were exposed or not exposed to a certain factor. So this table has four cells where A is the exposed cases, B is the exposed control, C is the unexposed cases, D is the unexposed control. So for calculating odds ratio, we multiply A into D divided by B into C, and this helps to tell if there is an association between the exposure and the disease. So odds ratio tells us how strongly the exposure is related to the disease state. So how to interpret odds ratio? If odds ratio is equal to 1, it means that there is no link between the disease and the exposure. If the odds ratio is greater than 1, it means that exposure might increase the risk of disease. If odds ratio is less than 1, it means that people who were exposed are less likely to have the disease compared to those who were not exposed. So coming to biases in case control study, which means errors in the result, it can result from bias in selection of cases, which occurs when cases chosen they do not represent a good or fair sample, affecting the result. Second one is the recall bias. In this, the controls do not remember the past exposure, as well as the cases provide less accurate information. Next one is confounding bias, which occur when several related risk factors they affect the disease, and it becomes hard to know which one actually caused it, confusing the result. Next one is overmatching. This occurs when the controls they are made too much like the cases. Last one is the analysis bias, which occurs during the odds ratio calculation. So coming to the clinical significance of case control study, it is a good tool for exploring the risk factors for rare diseases, as well as it supports the evidence of possible association between exposure and outcome of. So coming to advantages of case control study, first one is it is used to study rare diseases. Second one is it allows investigation of multiple risk factors at once. Third one is it is suitable for diseases which take long period to occur, for example cancer. So we do not need to wait for it to occur. Fourth one is it is useful in outbreak investigations, for example sudden infection outbreak. This study helps quickly to identify the source. Fifth one is it is relatively quick to conduct. Sixth one is it is more cost effective than other study designs. And seventh one is it requires fewer participants compared to cohort studies. So various limitations associated with case control studies include, first one is since it is difficult to find the right control group, if not selected properly, it can result in selection bias. Second one is information bias. In this, people may not remember things clearly, which lead to this. Third one is recall bias. In this, cases often remember their past exposure better than the controls. Fourth is it is hard to know what came first, whether it was exposure or the disease. Fifth one, it is not good for investigating rare exposures in which there are not enough people with that exposure. Sixth one is it cannot calculate new cases or total number of cases of a particular disease. Seventh one is that it does not establish causation, and it can only associate the exposure and the outcome. Eighth one is it is not helpful in finding the rates of disease in exposed and unexposed individuals. If you have liked the content, please like, share, and subscribe to this channel. Thank you.